So there are a variety of factors or different possible reasons why someone can have breast asymmetry. And they range from anything from certain types of cancer or following cancer reconstruction to congenital syndromes like Poland syndrome, where the chest wall fails to develop properly. But generally speaking, when we talk about it with regards to aesthetic surgery, what we mean is that somebody has just developmental breast asymmetry. They just grew like that. One side grew differently to the other, or it's following changes in body shape. So, for example, after weight changes or after pregnancy. So as with all aspects of cosmetic surgery or cosmetics in general, it very much depends on what the patient's looking for, right? So if the simplest, cheapest thing to do is if they just want something that looks good in clothes, to think about padding or prosthesis or something like that. That's a very reasonable way to do it. But of course, most people who I see will have thought of that option or already tried it. And what they're looking for is something that feels more like themselves. So you're talking about surgery of some description. Okay. And when you think about how you're going to treat it, you have to think, okay, what is the problem with, why is the breast asymmetrical? Why are they asymmetrical? And they're going to be very grossly asymmetrical for two reasons. So one is there's going to be a volume difference. One side will be bigger than the other. And the other reason is because the soft tissue, the skin envelope, which carries the breast, will be different on one side than the other. So one side might be more saggy than the other side, or something called tuberous, or whatever it might be. So when you address it, you need to address these two factors depending on how they are different. So if one side is bigger than the other, okay, well, your options to manage the size are to use implants, or to use something called lipofilling to increase volume, or a type of reduction to reduce volume. If you're looking at the soft tissue envelope, usually there's an element of sag involved in asymmetry in most of the cases I've seen. And in that case, you're looking at a breast uplift, something called a mastopexy. In truth, most of the people I see have a combination of both volume asymmetry and soft tissue envelope asymmetry. And I would say probably most of the cases I do involve a combination of uplift and augmentation. But it has to be tailored to the individual patients, as with all of these problems. There's no absolutely good candidate or bad candidate. I think the most important thing is that whoever's wanting the surgery has a realistic expectation of what results can be achieved. That to me is the most important thing. And part of that's not so much the person having surgery, that's my ability to express to them. And I think, so how do you get a realistic expectation of that? I think a very useful way is to look at photographs of the results that the surgeon gets, and kind of compare that in your mind with what you're expecting. And through the consultation, ideally, you'll both come to a similar range of, okay, this is what I can expect as a result. And having a frank, open discussion with the patient. And the patient having a frank, open discussion with you. I think that's really the thing that makes for a good, likely, positive outcome expectation. In terms of disadvantages, yeah, absolutely, there are disadvantages. Any surgery carries disadvantages and risks, and it's really important to recognize them. So the disadvantages or the risks are going to fall into the categories of the type of surgery used to correct it. So as we mentioned before, it's very often either lift or augmentation or a combination of those. And you will then have the corresponding risks. So the risks of lift, so the scarring, particularly scarring around the nipple and so forth, and the risks of augmentation, such as capsular contractures. So those are the risks and downsides. And of course, the risk of any surgery, as again mentioned before, is expectation. What are we both expecting as a result? if they're expecting one thing and I'm expecting another, then we will have an issue. So poor communication is a risk for sure. But generally speaking, I would say that people who come to the point when they want this surgery, for them, the benefits far outweigh the risks. And the vast majority of patients are not only keen to go ahead, but actually very happy once the procedure is done. So as for the answer to the previous question, it's really the same as for whatever type of surgery you're having, so augmentation, lift, combination, whatever it might happen to be. But very generally, it also depends on what you mean by recovery, because there are different types of recovery. So for a couple of days, you'll feel awful. You'll feel like, oh, it hurts, getting used to it, painkillers and so forth. You might feel a bit nauseated immediately after surgery. Then after about a week, most people are feeling pretty good and almost back to normal, really. By 2 weeks, they feel it. They're actually not. What you don't recognize is, even though you feel fine after 2 weeks, you're internally healing. So people will be going about their daily low stress, low exertion activity within a week or two after surgery. But they still need to, as I say, recognize they're healing on the inside, so we don't get back to exercise and heavy exertion until about 6 weeks after surgery. A lot of people will want to know when they can get back to work. It very much depends on what you do. The majority of people I see probably work at a desk, in which case usually a week or so is fine. But if you have more physically demanding work, that will obviously affect how quickly you can return to work. So it's kind of a difficult question to answer the kind of results people would expect, because it very much depends on where they started from, and also what kind of risk they're willing to have. So will they, for example, risk having a combined augmentation with an uplift, or would they rather just have an augmentation with just a lift, or whatever it might happen to be? I think the best way of getting a gauge of what sort of result you can expect is looking at the surgeon's previous results and comparing that with what you were thinking of as a patient might be the result. So that having been said, I have to say that the general satisfaction rate from this surgery is really pretty high. And as a surgeon, it's really satisfying. I think a lot of women who have breast asymmetry, they feel really, a lot of the women I see are very young. They've spent their teenage years feeling very embarrassed how they are, and not going out, or not wearing swimwear or whatever it is, and suddenly they find that they can, and they feel confident, and even in clothes they just stand differently. And so from a surgical point of view, it's really very satisfying to do.